It's so important to be educated about the disease of addiction. Today we're joined by Victoria Shields, our Naloxone Education and Distribution Coordinator, to chat about Narcan, some misconceptions about addiction, and how the landscape around the issue has changed. We also discuss what an ACE is and the upcoming ACEs, PACEs, and Addiction Summit. And later, is it good for kids to be bored sometimes? All that and more coming up on Health is Real.
Come on in, stay a while. Andrew Stinson here alongside Angela Taw and Zach Watson. The name of the podcast is Health is Real from Franklin County Public Health. Angela, how are you doing today?
Really good. Thanks for asking.
Great. Zach, how are you over there?
Magical.
Love to hear it. Well, I'm really excited for our guest today. Victoria Shields is here. She is the Naloxone Education and Distribution Coordinator here at Franklin County Public Health. Victoria, thanks for coming on today.
Hello. Thank you.
Now, tell us a little bit about your background. What brought you here to Franklin County Public Health, and what made you interested in the work that you're doing?
Yeah, so I'm a social worker, and I was working with individuals with substance use disorders and became really passionate about harm reduction. So a huge part of harm reduction is naloxone. So it was kind of a natural move for me. I also had always wanted to work more in policy and public health. I love direct practice, but sometimes you just want a little change of pace. So that's what brought me here to the naloxone program.
Awesome. You mentioned naloxone. I know, Narcan and naloxone are becoming more and more a part of our society. People are hearing about it more. They're seeing it more. Can you tell the folks that may be unfamiliar with it what Narcan's all about and how it works?
Yeah, so Narcan is a brand name of a medication called naloxone. So kind of like Tylenol and acetaminophen. All Narcan is naloxone, but there's, generic naloxone and other brands as well. And it's a medication that essentially reverses an opioid overdose. So if, you hear a lot in the news about fentanyl, if someone takes too much of an opioid, whether that is something illegal like fentanyl, heroin, or if it's a pain medication that they accidentally took too much of, it will temporarily reverse the symptoms of them taking that medication. So if someone takes too much and overdoses, the opioid is going to affect the brain in ways that it makes them feel that high, but it also stops their breathing, which is what causes the overdose. So the naloxone will both take away that feeling of being high, but it will also take away the effect that stops their breathing so that they can start breathing again. It is temporary, so it only lasts, depending on the person, how much they took, et cetera, like from an hour or a half hour to an hour and a half, but that gives time, for you to call 911, have the EMS arrive, and then they can take them to the hospital. So it's not meant to completely cure an overdose. It's meant to be a rescue medication that keeps the person okay while they're waiting to go to a hospital.
Yeah. No, that's great. And I love that your title, you do like a lot of education, right? Because it's naloxone education. What would you say when you are trying to educate someone about addiction? What are the misconceptions that you run up against, and what are some ways that you respond to those? Because I'm sure, addiction and overdose, like those words bring up a lot of different things in a lot of different people's minds. So what do you run up against, and how do you respond?
I mean, how much time?
Give
as long as you want.
As many as you want, but you can go top 3.
Okay. I think a huge one is that addiction is just about the individual. So we know that like 40 to 60%, so about half, because it depends on the substance, of developing a substance use disorder is related to genetics. So there is a lot of an individual factor. Do you guys remember, I don't know if you heard when you grew up in school, but the studies where they'd put like rats in rooms and they would pick like the water with the morphine in it. Mm-hmm. Something really interesting is that they redid those studies, and this isn't like a new thing. This was back in the 70s. So we've had this knowledge for a while, but where they made, I don't know if you guys have heard of the rat park studies. Mm-hmm. So they actually, instead of just putting rats in rooms alone, where they basically had food, water, and morphine water, they put them in a setting designed to meet their social needs and, give them things to do, let them do what they're naturally designed to do as rats. And the rates of using morphine went really, really, really low compared to the rats that were just, standing around in cages all day. Yeah. So, and it's kind of like, as a society, we have to think about, there's about 50% of that like addiction that is genetic. But it also has to do with the environment the community that someone comes up in, the resources that they're provided, the chances they get to fulfill their purpose or to, be able to feel like they're contributing to that society and things like that as well. Yeah. So I think we tend to view it just as that individualistic, like this is that person's problem, when really it's a symptom of a societal problem. Just because genetics has, put a switch in someone's mind for something doesn't mean it's going to get switched. So I think that that's one of the misconceptions that people have. And then another one I think is that substance use disorders are kind of like an other people problem if they don't know someone who's going out there using fentanyl. Substance use disorders are like, there's a huge range. So there's actually research that about 70% of alcohol use disorders resolve without treatment. And people don't realize that their friends have or have had alcohol use disorders, or that they have or have had alcohol use disorders. Like if you think about your friend who went a little too hard in college, maybe every weekend or weeknights too. And then after, they were out of that environment, managed to kind of change things around. Just because someone isn't, on the streets or isn't, out there using hard drugs doesn't mean that they're not affected by substance use disorders. And then also that kind of image that people have in their minds of people who use these substances are often not entirely accurate. I mean, it certainly can happen, and it often happens. Unfortunately, there's devastating effects to, severe substance use disorder. But I think just the idea that this is someone else's problem is a big misconception that we get. And also, like, sorry, like I said, how much time do you have?
Yeah, you're good.
And that you don't need Narcan on hand if you don't know someone who uses like hard drugs or fentanyl or anything like that. You never know when you might have to go to the hospital for something, get a pain med, and maybe you accidentally take too much of a pain medication, or maybe a child gets into your pain medication. Mistakes can happen. So even if you don't think, like, I don't plan to set my house on fire, but I have a fire extinguisher. So it's, the same situation. Unfortunately, one of the most common poisons ingested by children under 5 is opioids right now. So I think Narcan's important to have in the home, kind of regardless of your circumstance or experience with drugs.
Wow. Well, a lot of that was fascinating, and thank you. As someone who once lived in a rat colony themselves, I had no idea. So, we wanted to ask you, how's the landscape of addiction changed since you began, working in this field? I'm sure crises or events, they change, the way we approach these things change. Have you noticed anything in the time that you've sort of, been working in the field?
Yeah, I mean, I started working as a social worker like 9 years ago. So fentanyl has become a much larger thing just over the course of the past 10 years or so. Drugs are much more dangerous than they used to be. And that's, not meant to be a scare tactic or anything, but safe experimentation really isn't a thing that it used to be. So that has definitely changed. Also, on the positive side, though, attitudes towards harm reduction, I think, are changing for the better. It depends on where you're at and who you're talking to, but yeah. I know, and also access to some of these harm reduction techniques. Like, I bought Naloxone, I think it was 7 years ago, from a pharmacy, and it was like $94. And I just remember,
Wow.
Yeah. And I just remember the pharmacist, when I said I wanted Naloxone, they like looked real confused, and they were like, "Are we allowed to give this to you? Like, do you need a prescription for this?" Like, I think they even just outright asked me, like, "Do you use drugs?"
Oh my God.
Versus now, I think, at least in the outreach that I've done, here in Franklin County, that it is sort of starting to change, and people are seeing this as more of something to have in your first aid cabinet, and something that people know what it is. They kind of, they're more welcome or more willing to carry it with them too.
Yeah, I've seen it. To your point, I've seen it more at like on tables at events for free and everything. So it's, to your point, the prevalence of it has really, increased over the years.
It's also just like on the shelf now at grocery stores and drugstores. And I think the MSRP is like 50, so it's usually a little less than that.
Yeah.
So yeah, it's right next to the Tylenol.
Yeah.
Now, in your time here, what would you say is one of your favorite projects that you've worked on?
That's really hard for me. Honestly, so this is going to sound like a cop-out, but my favorite thing is just distributing naloxone in general and kind of seeing the effects from that. We distributed last year, I think it was over 20,000 naloxone kits here in Franklin County. And from 2023 to 2024, I think they're finding, I don't know if this data is like finalized yet, but about like a 30% drop in overdose deaths. And now that's certainly not like on me. But I think as a community, the efforts that we are putting in are having really good effects, and being able to see that and just knowing that, you know, I'm working towards that, I'm contributing to that, along with a lot of other great people in Franklin County feels really great. So I think that's my favorite.
Well, I'm glad you said about distributing Narcan, because there's a lot of ways that we get Narcan into the community here at Franklin County Public Health. So we do, direct outreach at tabling events, but we also have the mail order naloxone survey on our website. So if you need Narcan, you can go on our website, fill it out, and we'll mail it directly to your house for free, $99. So that's always a great service, and I love that we do that. So I had to put a plug in there.
That's a great plug. Love that. Also, you're involved, Victoria, with the ACEs, PACEs, and Addiction Summit that's coming up. Is that right?
Yep.
Awesome. Can you tell us a little bit about what an ACE is? That's a term that's probably not everyone knows about. What is an ACE?
Yeah, it stands for Adverse Childhood Experience. So anything from having a parent that was incarcerated, to having a parent that passed away, to having divorced parents, to being in an area with a lot of poverty or food insecurity, are these adverse childhood experiences that people can go through when they're younger that have significant effects on their health as they get older. And, mental health, substance use disorders are part of it, but also things like diabetes, hypertension. There's a lot of research into how, like, the more ACEs you experience when you're younger, the more likely you are to have chronic illness when you're older.
And I'm sure there's an economic impact to all that too down the road with
Absolutely.
all the healthcare costs. So we know what an ACE is. Then what is a PACE? Is that like the opposite of an ACE?
Sort of. It stands for protective and
Compensatory.
Compensatory.
Right?
I always
it's
want to say
word.
compensatory. It stands for protective and compensatory experiences. And it's essentially like protective factors that, okay, so maybe you're in an area that has a lot of poverty, but you have a really strong connectedness to a coach or a teacher or something that can kind of help to shield you from some of the negative effects of those ACEs.
That's awesome. And it's cool that, this is the second or third time that we've had this summit.
I think the third.
Third. Okay. Yeah. And we've done it every couple of years. So it's nice that, there's still a lot of interest from the community to continue to have just a day where people come together and learn about these different things and how we can bolster our community in that way.
It's about resilience.
Yeah.
Right. It's about resilience in the face of these things. One thing we like to ask all of our guests, and I know I don't want to put you on the spot, so if you don't want to answer, you don't have to, but it's like a magic wand question. Basically, like if I handed you a magic wand and said you can change anything you want related to public health, what do you think you would change?
Unlimited funding.
Yeah. Money,
I hear that.
money.
I like that.
I hear that. Yeah. Great. I mean, that's the shortest answer we've ever had for that. And you know what? That might be the best answer we've had for that.
Yep.
Concur. Is there anything else that you would want the audience to know about, anything that you're working on or like, just, I don't know, maybe a misperception or misconception or just stuff that they don't know? It's your time to say anything that you really want to hammer home to the audience.
Just carry naloxone.
Yeah.
Get naloxone for your kids. You're not encouraging drug use. Like I said, getting someone a fire extinguisher you're not telling them to go catch your house on fire. It's like I mentioned before, there's really just no safe experimentation like there used to be. So it's just a safety measure that we can have, like putting your seatbelt on when you get in your car. And I think every single person in the world should be carrying naloxone. Almost all overdose deaths are preventable. So, yeah.
Absolutely.
You can
great.
get it in the mail for free.
Yeah.
Absolutely. Get it in the mail for free. Victoria Shields, she is the Naloxone Education and Distribution Coordinator here at Franklin County Public Health. Victoria, thank you so much for coming on the podcast
Yeah, thanks
today.
for having me.
This episode of Health is Real is brought to you by Graphs. What do you have to say about Graphs, Farmer Joe?
Oh, I love grass. There's Bermuda grass, Kentucky bluegrass, ryegrass, wheatgrass,
Actually, I didn't say grass. I said
lawn grass, goose grass, oat grass, cat grass, fountain grass.
Farmer Joe, that's not what we're asking. We asked you about graphs.
Yeah, like I was saying, sweetgrass, switchgrass, needlegrass.
no graphs, Farmer Joe. Graphs.
Yeah, like bar graphs, line graphs, scatter plots, pie charts.
Oh, I love pies. There's pumpkin pies, apple pies, blueberry pies.
That's enough, Farmer Joe. Graphs visually represent data, allowing people to easily see trends and patterns between different variables.
Yeah, they make complex information more accessible and easy to understand.
Oh, I understand. They use visual elements like lines, bars, or dots to depict data, making it easier to interpret than raw numbers alone.
Now you've got it. Graphs. They help us communicate. We've got an article here from the Cleveland Clinic. Why it's okay for kids to be bored. Kids should be bored sometimes.
Honestly.
I mean,
yeah.
While it can be tempting to help entertain your child when they say they're bored, you may want to let them figure it out on their own. When we're constantly entertained, it doesn't lead us to opportunities to occupy ourselves and engage in activities like reading a book, playing with toys, or building a fort. I feel like we're going to sound like a bunch of old people here, be like, put down the phones. But sometimes, let's put down the phones, right?
Yeah. I actually saw an interesting study the other day that said that kids, it takes them 45 minutes to come up with if you put them in a certain environment, like say you take your kids to the park, right? And you're like, okay, go have fun. It takes them 45 minutes to figure out all the things around them and come up, imagine a game or an activity with all the people, with the other kids around them. So I was like, wow, I really didn't think
That takes a while.
I know, but I mean, that's the thing that if you leave this space, if they come back to you in 10 minutes and they're like, this sucks, I don't want to be here, I'm bored. It's like, well, hold on. You haven't even given yourself a chance to figure out what can be done here and what you can play.
Yeah. Yeah. And it's just important for developing creativity, imagination. Let kids, come up with their own games, make up their own fun sometimes. But also what this article mentions is that parents need to practice what they preach. And oftentimes, if a child sees you on your phone all the time, and I'm looking at myself because that happens to me on occasion, then when they're bored, they're going to think, I want to just look at a screen too. That's what people who are bored do, right? They just go on their phone, they watch TV, they do something like that. And that's not always the best thing to do. So I'm speaking mostly to myself here at this table, but parents need to practice what they preach on this.
Well, that's a valuable lesson.
Yeah.
It's,
Or I feel like even to sort of explaining what you are doing on your phone sometimes, obviously within context, but I'm just thinking I read books on my phone sometimes. So a kid could be looking at me and just see me on my phone, but really I'm reading a book. So in those moments too, it could be worth just
You read books on your phone?
Sometimes, yeah.
Interesting.
Yeah.
Okay, so you don't have an e-reader or anything? Okay.
No, I either I prefer having a hard copy book.
Yeah, me
for
too.
sure.
Yeah.
I love the smell of books. It's the best.
I agree.
But then sometimes it's well, I just don't. I mean, I'm not going to bring a whole 900 page book with me everywhere I go. So sometimes it's nice when I have when I'm on my lunch break, I can just pull my phone out and read off of my phone. Yes, sir. Please? What is so funny?
I can't help
Chuckles
my brain.
Mickey over here.
Okay, well, first off, we both know that's not my name. So I couldn't help myself because my first response to you when you said I can't bring a 900 page book everywhere was no, be toxic, do it. But I thought, I was like, well, like, why would I said, Angela shouldn't, and again, in my brain, I'm like, Angela shouldn't care about, the size of the book or like just taking it everywhere. I know it can be a lot to lug around, but like, what's she worried about? And then I pictured you carrying like a thick manuscript size book, like,
War and
how,
Peace.
like, how like you War and Peace, or like, how like monks in movies or television shows are depicted where they're just lugging a giant book. And I was just like, okay, that's kind of funny to picture Angela just like going to a library and just plopping down like the Gilgamesh or like whatever like
You have a purse that's just the same size as the book, and you open the purse and just pull out the big book and throw it on the
she
table.
would literally need a book bag, and it would finally make the phrase book bag be appropriate, because you ain't
One
getting you ain't getting multiple books in that bag. It's just that book.
I actually did make a purse for a friend specifically that because we were reading this fantasy series and the books were really, really big, like at least
Fantasy does tend to get
it
large.
was at least like 600 pages each. It was like a
Wow.
9-book series.
Oof.
So I made her. I had all the books, so I checked, and every single book fit in the purse that I made her. And I was like, you can only ever have a book in your phone in this bag.
Bravo.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov, and be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.